let's get this show on the road. Good morning, my name's Lori Stone. I'm the state representative for the 13th House District, which includes Eastern Warren and this region of Detroit between City Airport, Gratiot, all the way down to 94. So right outside our back door, and I'm so appreciative to the Franklin Public Library branch to invite us in and use this space for this purpose. Let me tell you, show of hands, was anyone here 2 months ago? We had some new faces in the room. Wonderful, wonderful. I come to the state legislature after teaching at elementary school for more than 14 years. Really, that's my heart to serve, was to make sure my students had a voice in Lansing, people who had experience in education, in classrooms, helping to shape educational policy. And I've been proud to serve. I'm starting my 3rd term. I even did my student teaching down at Bellevue Elementary in Detroit Public Schools. I just want to raise up that I have community conversations every month, and I rotate through the district. And during the summer is my favorite because we do community conversations in the park, and we do picnics. And this summer, June 17th, we'll be at Veterans Memorial in Warren. July 15th, we'll be at Miller Park in Warren, and August 19th, we'll be at Washougal Field right down the street here. And super appreciative because Olive Garden offered to donate their services for catering all 3 events this summer. So come, bring a neighbor, bring family, and keep these conversations going. In addition to having food and fun and conversation, we also bring together resources from the community to have tables on site. So, you know, community members have conversations about what they need and where to get it. Make it easy. So if you haven't already received a mailing, there are extra copies up here on the table. So make sure you grab one for a friend. I try to keep my community conversations to the 3rd Saturday of the month, so it's predictable. People can put them on the calendar and come back week after week, or invite someone to come with them. It's typically at 11 a.m., although the locations rotate throughout the community. I just want to tell you a little bit about my staff, because if you are reaching out or at an event, you'll probably run into them. My legislative director is Dawn Jakubowski. She's been with me for all 3 terms. She's worked all the positions in the office and works hard for the community. My constituent director is Devin Dudley. He is new to the office this term, and he's usually the first person you encounter when you make a call to the office or you're emailing for assistance or with a policy recommendation. We usually include 1 to 4 interns. Often they're college students from the Lansing area. We're always on the lookout for interns to add to our staff. So if you know someone who's interested, please make a recommendation and connect us. It's a great opportunity for firsthand experience in the legislature, to assist in the district office, people who want to volunteer and help a neighbor, community events and for outreach. They get experience with assisting in policy development and attending committee meetings in session. Get that firsthand experience, especially for people who have a heart for service and maybe an interest in public administration. It's great, a resume builder and great experience to have. What is a community conversation? What is it not? This is where I always lean back to my elementary roots, set the ground rules and expectations. Community conversations are the regular updates from your legislative and elected officials. It's an opportunity for transparency and accountability. It is an opportunity to ask questions, share concerns, and request assistance in person, face to face. It's not a public debate forum. I do encourage you to share your positions on information and your reasoning why. But I ask that everything, all the conversations are respectful with civil discourse. This is the closest I get to being back in my classroom, so I really enjoy it. I always take the opportunity to explain what is a state representative, because I've encountered all kinds of expectations. And the one that really concerns me is, I can't bother you. Your job is too important. And that's when I realized that the community needs to better understand what a state representative is. A state representative is the lawmaker that you were taught in social studies class, right? Schoolhouse Rock. We create policy, we serve on committees, and we vote on budgets. But I like to think of my job as your customer service in Lansing for state government. When you need help navigating bureaucracy and you are so frustrated, call me. The greatest assistance I've been able to offer was during the unemployment crisis during COVID-19. We helped over 2,000 people in the community because they couldn't get through to an unemployment department. It was a mess. But my office became de facto unemployment for the community, and we didn't let anyone fall through the cracks. We serve everyone in our community regardless of party. I don't ask who you voted for, I ask how can I help you. We deliberate on policy in committees. So hearing your position helps me when I'm trying to figure out how do I shake out on an issue. I represent roughly 90,000 individuals. I get calls, emails, community conversation participants, send out mailings, try to find a lot of ways to communicate. When there's big ideas that I find the community would benefit from, I try to host town halls, round tables, but I also attend community events. I love being invited along. I visit local businesses and organizations to better understand what's available in our community and what's still needed. One of the things I realized is, a lot of people come and say, we need this. And the more I visit resources, community organizations and resources, I realize how many of those resources are already available but are being underutilized. And so I take pride in being able to connect people with the resources that are already there and look for ways that we can bolster those. My voice is our voice. I advocate for community needs in Lansing, and among local governments and across levels of government. I have the opportunity to provide recognitions like legislative tributes. So if you know someone who is having a milestone birthday, anniversary, a significant community event, or a business event, reach out to my office. I'd gladly offer that recognition to get a signed tribute from the state of Michigan that's framed, and to be able to hang it up or to celebrate someone is very special. I also would be glad to be a guest speaker if you are part of an organization that you think would be like to talk more about community events. I also speak with local organizations I love to speak at schools during March's Reading Month. It's big. I love to talk to government classes and leadership programs. And we love having scout groups that are working on their badges to learn a little bit more about government. Any questions about me? I like to break it up a little bit, and lately I've found that I've got so much information that simply waiting till the end for the questions, people are like, I don't even remember what I wanted to talk about. Okay, I'll jump into policy a little bit more and open it up for questions, comments, thoughts. So the biggest issue facing Michigan residents that they don't even know about right now is Medicaid redetermination. There are 3 million residents in Michigan who receive Medicaid for their health insurance. And the end of the COVID emergency means the end of guaranteed coverage. What that means is during the COVID emergency, the federal government said no one should fear seeking health assistance during COVID because they are concerned about medical coverage. They said we will cover everyone. And for roughly 2.5 years, everyone who does not already have health insurance, who seeks help, automatically had it. That was an increase of about 700,000 Michigan residents. So families like my sisters who moved from Florida to Michigan during COVID, when they went on the marketplace, they were guaranteed coverage, regardless of income or background. Now that the emergency has rolled back, one of the benefits that have rolled back is guaranteed eligibility. So over the next year, Medicaid in Michigan is going to go through their complete rolls of 3 million people, and I think I calculated that's about 60,000 people a day that the Michigan Department of Health and Human Services has to reevaluate. Now, the easy part is if people already qualified for other state assistance, some of those people can automatically fall off the rolls. Their eligibility is predetermined and they're not too concerned about that. That fast tracks them. Then there's about 50% of people on Medicaid do not have current contact information on the database, which means someone's going to show up at an ER or a doctor's appointment. They're going to think that they're up to date on their health insurance, and they're going to discover that their eligibility has not been redetermined. What does that mean? We need to talk about this in the community. We need to make sure that anyone who is currently receiving Medicaid has any of their current information up to date on their database. Anyone who, some people get nervous because what does this mean? Does this mean I don't have health care anymore? Like, if I don't have this conversation, you know, what's going to happen? We know that many of the people who are not Medicaid eligible are eligible for the ACA Obamacare marketplace. And many of those people who have income constraints are eligible for subsidized health care. And some of those plans are as low as $10 a month. So we want to make sure that everyone in our community has access, knows their eligibility, and we help direct them to navigators who can identify what that support looks like or what the best plan is to take care of their medical needs. So please help me lift this up. This is my friend Earl. Say hi, Earl. Earl, he, in his retirement, I don't know if he's actually retired. He's pretty much working full time.
No, GM said in 2008 when we got into financial problems, please leave. And I said, okay.
So Earl uses his background with video and communications to record these meetings so that they can be reposted to social media. So as you're listening, if you know someone who would benefit from any of the information today, please redirect them to this recording.
That'll be up on your site.
It'll be up on my website, so find me on Facebook. Yep. There's a rolling review over the next year, so not everybody drops off. Depending on when they registered for Medicaid assistance is when they're up for review. So the first group is coming up in June, and I'm starting to get calls. And one of my concerns is the same people who struggled through unemployment and felt the government forgot them and left them behind now feels like they're under attack because their health insurance is not being covered. So I reassure them that the government's not out to get you, that this is part of the process and we're going to help you through this just like we helped you through the last one, and let them know that there's pieces in place. Any questions about Medicaid redetermination? That's a big one. Okay, if anyone wants to follow up later, let me know. Yeah?
What would cause a person to lose their Medicaid?
Medicaid coverage is an income eligibility requirement. So I can't tell you because it depends on how many people in the household, what the income is. We can help direct you to MDHHS and they can let you know what that breakdown looks like.
So it's based on income?
Exactly. Yeah. Good question. Okay, right now in the state government, our priority is budgets. We're working on the state budget for the 2023-24 year. Technically, we have till September 31st to get that over the finish line, but the new standard, what we've held ourselves to for the last, half a dozen years, is to have it done by the end of June. Because the fiscal year for schools and local governments starts July 1st. And so if we are not letting them know how much they have to work with in their budget, they've got a problem, because they're making a budget on numbers that they don't know that they're going to be reimbursed from the state. So we're working hard in getting that out. Currently, the governor has a budget, the Senate has a budget, and the House of Representatives each have a budget. We've introduced them, and these are proposed budgets. So twice a year, the state, all the financial actuaries go through and estimate how much revenue, how much taxes the state's bringing in. And that's called the Consensus Revenue Estimating Conference. And they just held that on Friday. So they do it once in January and they do it once in May. And once we have the numbers in May, that's what we set the state budget on. We know because of inflated costs that we've had higher than average tax income. Now we are going to begin negotiating between the House, the Senate, and the governor until we can come to an agreement on what that budget looks like for the next year. We often consider budget as a reflection of values. So where we put tax dollars, first is where the services that people expect, and then also is what are the things that reflect our values. And so before June 30th, you can expect a statewide budget. In my position, having a position that covers both Detroit and Macomb County, I am on the Detroit caucus in the legislature. That means all the legislators that represent a portion of Detroit's population work together to get the priorities for the city and for Wayne County past the finish line and make sure that they get funded. Among the funding priorities is additional funding for Detroit, but also statewide for affordable housing. The state's already allocated $150 million in affordable housing, and local groups are deciding how to invest that. But we know that there's a whole lot more. Water affordability is a priority, mental health funding, and public safety. These are on the short list, and we keep working to get as much of that over the finish line. I also work on several committees. I'm on the Education Policy Committee, Insurance and Financial Services, Military Veterans and Homeland Security, Agriculture, Affordable Housing Subcommittee. And so in education policy, right now we continue to work on short-term and long-term solutions for teacher shortages. In insurance, we're working on health insurance affordability. We've been taking testimony on prescription drug pricing. So everyone likes to go, it's them. They're the ones. They're the reasons your prescriptions are so expensive. And our job is to give everyone a haircut, right? So no one part of this is why your prescriptions are so high. But there's a lot of people with their hands in the pot saying, pay a little bit more. It's not going to come out of your pocket. We'll give you rebates, we'll give you discounts, but someone's paying for it at some point in the process. On the Military Veterans Services and Homeland Security Committee, we voted to allow National Guard members to transfer educational benefits to their spouse or children. And we've heard from members who said, I'm not going to use these benefits, but I earned them. We don't want them to go to waste. And so listening to that ask, we were happy to make sure that that earned benefit goes to someone. We've focused on mental health for those that are serving, and those are veterans. There are higher rates of suicide in these populations. Remind us that we need to be concentrating efforts, reducing stigma, reducing barriers to access to health care in order to make sure that they're not suffering. Agriculture was a surprise for me. The last farm in Warren was about 50 years ago. But the longer I've been on the committee, the more I've learned about, well, one, we are part of the supply chain for agriculture. Michigan is the #2 most diverse agriculture production in the country behind California. Part of it's because of our geography, and so we don't just grow one thing, we grow everything. So we've had dairy farmers, egg farmers, and potato growers in the last few weeks, talking about what is that impact on supply chains, what is the potential for earnings, and addressing some of our concerns about the rising prices. Affordable Housing Subcommittee, I did want to make you aware the city reached out to me with promoting their down payment assistance on first-time homeowners. So if you know someone who is in the market to be a homeowner, wants to transition from rental properties, please reach out, and they have up to $25,000 in assistance to get people in homes. We've had informational hearings from housing developers, realtors, property management. In the last 2 weeks, we also heard from Second Chance advocates asking for some of the barriers to affordable housing for returning citizens. And we know that getting returning citizens into housing is one of the biggest impacts on reducing recidivism. So if we don't want people going back to prisons, having a house makes the difference on getting a job, being back in the community, and we know that there's a lot of people that depend on returning citizens. Any questions on committees? I know, it's a mouthful. You think that's busy? That's my schedule. In the first 5 months, it's hard to believe that it's just May. We have we've done some very epic and eventful legislation. Things that people have been working 40 years to get past the finish line, some of them as much as 100 years past the finish line. I'm so proud to be part of the 102nd legislature that finally got them past the finish line. So we've had $6 billion in revenue surplus last year, and that includes federal dollars because of COVID, ARPA funds, what else? And so we helped to return some of those tax dollars through the earned income tax credit to working families, instead of giving them back to corporations. We also repealed senior retirement pension tax. And again, it's going back to working people that, and making sure those tax dollars for people who took the greatest hit from inflation are getting the greatest relief. We passed gun violence prevention legislation, being a teacher who had to teach first graders and second graders about red alerts and shelter in place and how do we escape a building. I'm very proud of the work we did. We worked with, among others, Moms Demand Action, Everytown USA, and Gabby Gifford's organization, Advancing Universal Background Checks. And when I talked to Second Amendment holders, that these are about parity, right? This is about if you buy a gun, you are held, regardless of where you buy it, to the same standard. If you own a gun, you are responsible for storing it safely. We haven't added new burdens. We've required that everything be treated equitably. We continue to work on red flag laws, otherwise known extreme risk protection. So we know the #1 cause of death from guns is suicide. And we talk about, you know, shootings at schools, we talk about community deaths, but if someone is struggling in with mental health issues, guns are one of the most decisive ways to address it, and there's not a whole lot of recourse for that. And so being knowledgeable about this and being data driven with how we implement policy and who we're there to help is important. So even having gun locks, making sure they're stored in safes can be that barrier, that time that gives people the chance to reconsider their options. We have worked on restoring workers' rights. I was at the Capitol when the Snyder administration implemented right to work, and I was at the Capitol putting the vote to repeal it. We restored prevailing wage, which makes sure workers who provide labor don't have wages sacrificed to underbid contracts. So if you contract with a local unit of government, those workers are being paid fairly. We repealed the 1931 antiquated abortion law because it contradicts the constitutional amendment Michigan voters adopted in November that guarantees access to safe abortion health care. Governor Whitmer signed into law the civil rights protections for Michigan's LGBTQ residents as part of the Elliott Larson Civil Rights Act. Any questions on some of those landmark pieces of policy? Okay. My personal priorities over and above what I'm working on Tuesday, I had the opportunity to testify in the Family, Children's, and Seniors Committee on my homeless youth package. I serve on the Homeless and Poverty and Homelessness Caucus, and I'm the subcommittee chair on youth homelessness. I saw the impact firsthand in my classroom, and it's one of the reasons I'm such a staunch advocate. And we would bring in outside speakers who are providers in the community who could speak to what are the gaps. Among the gaps they identified were the window to secure permission. So if a youth wants to seek help in a shelter, that shelter still has to secure permission from parents or guardians. And they have a lot of barriers, including that youth might not currently be residing with a parent or a legal guardian. We know that many youth seek the opportunity to couch surf or even sleep in the streets instead of going to a shelter, because if they can't secure that permission within 24 hours, they have to turn that youth over to Child Protective Services. Because of, parents might not have the same cell phone number. They might not have been in touch with a parent or legal guardian recently. Working hours might not be the same. And so the federal guidance advises that shelters should have up to 72 hours, up to 3 days, to work with that youth and the community to find their legal guardians and to secure that permission. House Bill 4086 realigns Michigan's residential definition for youth for transitional living services. So aging out of Child Protective Services or a homeless program. So Michigan got its hand slapped a few years back because they were housing juveniles with adults in correctional facilities. And instead of looking carefully about how their policy affects different contracts and services, Michigan said no juveniles will be housed with adults for any purposes. And what we learned was we have contracts with these transitional housing providers that teach youth how to be successful adults surviving independently, and their contracts were not nullified. They can't house these populations together. So who they can serve is limited. And so this is a very niche carve out that is in alignment with the federal guidelines, but it's something that we need to take care of because we have contracts with these providers, and it doesn't make sense for them to be providing services but not to the whole population. And then the last piece of this package allows access to medical services for homeless minors. So currently you have to have parental permission or guardianship permission if you have a medical procedure that is not an emergency. Emergency being like life-limiting. And so youth that are receiving services, if they can't get a parent to consent to dental procedures, mental health procedures, or even physical checkups, could be struggling until they're turned 18. And so we had one young man come in and testify who was kicked out of his house. The parents wanted nothing to do with him. And for about 2 years, he was fortunate to seek services from shelters that helped him, but he wouldn't have had access to medical care without them. So a toothache, I can only imagine if you had a toothache for 2 years. So I was very thrilled to have testimony on that. Sometimes just getting the hearing committee is hard enough. We're hoping to get it voted out. We're working with community stakeholders who have concerns about how the language is in law to refine that and make it better, make it stronger. I'm very excited. Thursday, I'm an advocate about disability rights, and one of the pieces of legislation that a parent brought to me for almost 4 years ago is around universal height adjustable fully automated changing tables. And I never considered what happens to someone who needs diapering or toileting needs when they've aged out of infant changing tables. And the answer is largely they are changed on dirty bathroom floors. They're changed in the backs of vehicles. Or they might not go out to public events because they can't take care of their most basic needs. And so Liam's Law comes from Jessica Gomez, who's been a huge advocate around changing spaces. There are changing spaces advocates through all 50 states and internationally. And these changing tables mean that people can go to sporting events, go to the zoo, go to the airport and take care of their needs. It's an economic booster because not only will they go down to a concert, but after they take care of their needs, they might go out to a restaurant afterwards as well. For people who have disabilities, even in other states, this can expand our tourism. So I have a friend who is a triple amputee, and she's from California, but she said when her family decides where they want to go on vacation, they have to make sure that it has accommodations, that it's easily accessible. And so by including more of these facilities in Michigan, it means that it expands who we serve as tourists as well. So some people always think about regulations and how it might be limiting. I want to point out that sometimes it opens up access for more people than you would anticipate. So we have a press conference on Wednesday. Hopefully it gets some airtime. And this is about accessibility, inclusion, health, and well-being. We introduced our 90-day prescription bills, which came out of COVID when the governor mandated that every insurance had to provide up to 90 days of maintenance prescriptions. That changed my life. Instead of going to the pharmacy 4 or 5 days a month to pick up different prescriptions, I was going every 3 months. I talked to my physician, and she's like, you know what? More people are adhering to their prescription protocols because every time you have to go fill a prescription, you have to worry that, do you have the money? Do you have the time? Are you there when the pharmacy's open? And so that can be problematic. And if people are on heart medications, blood pressure medications, every time you disrupt that treatment, it causes greater problems. And so many people have access to 90 days of prescriptions at a time. We want to continue that. Again, through COVID, we saw pharmacists were providing routine vaccinations. And what I learned was a pharmacist has to have any vaccination they administer signed off by a physician. And that physician may never see you, may never see your chart, might never report back to your physician, but they have a job in the chain. And what we looked at was, are pharmacists capable of independently providing those? And overwhelmingly over the last 2 years, it is clear that they can do this. It's within the scope of their job and training. And so that's what we're working on. We repealed the arbitrary retention of third grade students for not passing standardized reading tests. And if anyone knows me, they know that I was a 4th grade teacher for 11 and a half of that 14 years. And I saw the writing on the wall when this was adopted in 2016. It was arbitrary and punitive for these kids. It didn't make them perform better, and it wasn't the problem, it wasn't even a symptom of the problem. Now we're redirecting funds to make sure that those kids are being identified sooner, the resources are in place sooner, and that they go beyond 3rd grade. They don't stop when they're at 3rd grade. I've done work around the Kratom Consumer Protection Act. We had a testimony, I offered testimony in committee. We're working on raising awareness. If you haven't heard of Kratom, it's something I'd love to talk to you about more. But it's also something I'd love to see a vote out of the committee. A kindergarten prerequisite. So right now, any parent could enroll a child directly into 1st grade. No preschool, no kindergarten. The problem with this is kindergarten isn't just socialization anymore. There's real curriculum and instructional growth that happens in kindergarten. So if a child with no educational experience is dropped in a 1st grade classroom, that 1st grade classroom teacher has to prepare a classroom of kids for 2nd grade, as well as picking up and catching up 1 or even 2 children of all of kindergarten and 1st grade. And that's a problem. Now, it only affects a small portion of students, but it does make a difference. And another bill I'm working on is financial literacy. Overwhelmingly, high school students say, I'd rather be learning about financial literacy than even Algebra 2, because one has a very real role in what I do next. That's the policy piece. Thoughts or questions about any of those pieces? We'll open it up for broader discussion, but if there's anything I touched on that you want to dig in a little bit further. Yeah.
You said something about in the 3rd grade they stop. You were saying
I'm
stop.
sorry. Yes.
Stop what?
So in 3rd grade, that's the first time they take a standardized test. They have other assessments, reading levels, unit tests before that. But that's when we give the M-STEP test. And any 3rd graders who are not proficient at 3rd grade reading are encouraged to be retained in 3rd grade. The problem is, so as an educator, I encourage parents who want to give their child an extra growth year. Kindergarten and 1st grade are those years that you want to repeat, right? Gives them more of that foundation skills. The problem is, once you get past 1st grade, those kids have a very real awareness of who their peers are, their cohort. And if they get left behind, if they get separated from their peers, then there becomes a social stigma. And I know, so Michigan patterned this off of Florida. And my sister's, one of her nephews in Florida, was able to articulate. He was already graduated from high school. His mom was a teacher, his aunt was a teacher. He was retained in 3rd grade. He said, I felt like I was too stupid to learn. I felt I was humiliated because all my peers left me behind. I was never going to catch up to them. And I thought that's pretty profound that someone could articulate that this was their experience. And so the general idea is, one, we need to identify kids with learning disabilities sooner. Why are we waiting till 3rd grade to arbitrate? Why did we pick this arbitrarily? Second of all, we put a ton of resources into kindergarten through 2nd grade to make sure they're reading on level by 3rd grade. But if you have a learning disability, it doesn't stop at 3rd grade. You're going to need those assistants all the way up. And so it was a budgeting thing, right? One, we're going to threaten and intimidate those kids to take education seriously and get past learning disabilities so they're on track with their peers. But what we've learned is that this is not best practices from an educational perspective. It doesn't go with what we know of kids and development. That make more sense? Thank you. You can tell this is what I'm passionate about. So 3 days a week, typically I'm in Lansing, Tuesdays, Wednesdays, and Thursdays. That's when we're taking care of house business together, committees, in session, votes. But Mondays and Fridays, and occasionally Saturdays and Sundays, I work in district. So anyone who's saying your state legislators, they only work 3 days a week, they're just sitting at home collecting their paycheck, it's not a thing. On Mondays, Fridays, and the rest of the week, I am answering constituents' requests and correspondence. I'm working on developing that legislative policy, so you have meetings during the week and you go, ooh, that's a good idea, we need to work on that. Usually it's not while we're in Lansing, we're so swamped with meetings. We also take meetings virtually and in person when we're in district. It's a great opportunity to tour and visit district organizations and businesses, attend events. And so I say that to say that we work in at least 5 days a week, sometimes 6 and 7. Right now I'm hearing from constituents about good time makes good sense legislation. This is policy because Michigan has some of the strictest and longest incarceration policies in the country. And so we're starting to take a look back and saying, does the penalty fit the crime? And does the penalty get the results of, rehabilitation? And what we're finding that it's not. And so the dilemma is, one, anyone who's been a victim of a crime, who knows the perpetrator has been sent away for a certain period, has a certain expectation. And so peeling back some of those penalties can cause a rift for that survivor. But we also know that penalties should fit the crime, and that's not always the case. And so we're taking a look and we're revising some of those criminal justice issues. Let's see, I'm almost done. Ooh. Today is Armed Forces Day. We pay tribute to all those who are serving in the United States Armed Forces. We thank you for your service. If you or a loved one serve, without our armed forces, we would not have the freedom and the democracy that we have today. It's observed the third Saturday in May as part of Armed Forces Day, as part of Armed Forces Week, and part of Military Appreciation Month. Also, May is Asian Pacific American Heritage Month. I was part of the celebration for the Hmong American Day at the Capitol, and we had APA Heritage Day with cultures and music and dance and food, and it was a wonderful celebration. Sorry, I don't think I brought water today. I think we mentioned before, I'm active on Facebook. I usually post 3 to 5 days a week what I'm working on, information, policy that's going through, historical perspectives, information. So if you want to kind of follow along and stay up to date, sometimes I get to dig in a little bit more where news media might give you a headline or a sound bite, and sometimes people are left with more questions. Just a reminder, mark your calendar. The first community conversation in the park is at Veterans Memorial Park in Warren. Again, Olive Garden is donating the food. It's going to be tasty, delicious. And we will have resource partners tabling, so come out and join the fun. Again, grab them. We have 3 of them this summer.